I thought after 13 years, after my bone cancer, I was cleared of cancer. Then it hits me again. 2 years ago, I was diagnosed with breast cancer. I never knew how strong I am until I walked this journey. They normally say like that, you don't understand. I would say, I understand, because I have walked this journey.
As a social worker, I look at perception and an expectation of how I face the issue. That's how I constantly adjust myself, not to stay at status quo, but to inject new ideas to embrace change. We follow the flow of the water. How we flow is important towards facing the challenge we are facing today.
My wife and I have always had a heart for the under-resourced, underprivileged, and the opportunity arose for us to go and spend some time in Timor-Leste. The work that we did was quite specific to teach, to help with research, and to help to train the local doctors. The situation there was pretty challenging. They had a major flood coupled with the already under-resourced society and health system.
The COVID pandemic was a situation that rocked a lot of their boats because information was not presented in a way that they could understand. Things was happening really fast. We decided that we really needed to have a way to connect with them, and that's how we came up with a CARES kit to put together activities, resources that was familiar to them, would still give them an opportunity to be part of something that was normal.
The last 2 years have given healthcare workers the opportunity to really show their mettle. When patients come to us for help because they are unwell, there is always associated stress and anxiety and worry. And sometimes it's the little gestures, the little small acts that we do that can make all the difference to them.
My relationship with my foreign colleagues are like families. I also help them along when they face difficulties back in their hometowns. The foreign nurses will come to me and share when their family members fall sick. As a big sister in the ward, I spend time being there, support them, and sometimes what they need is just a listening ears.
Whether you are non-clinical or clinical staff, we all have a role to play in healthcare. When you look at healthcare transformation, it really requires interprofessional teams to work collaboratively together. How we all play a role is really to look at how we can improve teamwork, and through there, get to actually appreciate each other's experience, perspective in the process of co-creation.
We have an amazing job, working alongside colleagues who are the best in their field, right? Who care and think of ways to make things better, who are willing to go the extra mile. It makes me want to come back and contribute and really be a part of this microcosm. It can be difficult because there are a lot of demands. If we work together, we look out for one another, there's so much good that we can do, so let's do it.
In 21/7 to 21/8, practically every month there's a staff injury incidences. These violent patients can be triggered very fast.
I believe everyone wants to work in an environment that is safe. Don't want to feel threatened. They want to exercise their duties without any fear.
Once we have this code-wide activation, the nurses team, the security teams will come together at the same time so we can handle the situation. They're very confident. They know that there's help from others, so they'll be able to focus on their job.
During that COVID year, the amount of applications to NKF increased by 50%. There are many changes to existing in-flight patients. They cannot eat, they cannot drink, they have to follow all the rules that COVID comes. And at the same time, you have many new patients coming in who has less face-to-face time with our admission counselors, with our doctors.
The IT has really stepped up the game. Overnight, we couldn't meet face-to-face for meetings. They had to install application overnight to ensure that we will be able to be connectable.
Actually, someone ever asked us, why don't we just buy from market? Actually, there is nothing to meet our requirement. That's why we design our own equipment.
We see the patient able to be independent earlier. We literally see the outcome, the result, and that is very encouraging. We also see patient can be discharged slightly earlier because they're able to move slightly earlier.
Whenever a COVID patient actually enters the hospital, there will be several groups of healthcare professionals that will be treating the patient. Each of us have our own role to ensure that procedure rooms or walkways, corridors are actually sterilized to prevent any cross-infection.
Collaboration in healthcare brings change. To design such a hardware, need expertise. Through the team, there's medical physicists, radiation experts, radiographers who are clinically specialized so that they can give their best input to see whether patients do feel safe when they're inside the X-ray booth.
Well, we all do reach the end of life at some point, and we do hope that when our time comes, we have a good closure. This collaboration is not just with the home care and the nursing homes, but also the inpatient wards. And with this, the patients can transit across settings, whether it's an inpatient setting, home care or nursing home, quite smoothly and seamlessly.
Recently, there was just a case that was referred to the Violet program. This patient actually prefers to actually demise at home. So we actually got in touch with the Violet program, the team, quite smoothly, and then arranged for them to visit the patient at home. And the patient will actually pass away peacefully with a family's presence on the same evening itself. We cannot cure all the time, but I think we definitely can actually comfort all the time. And in palliative care, I think this gives us an opportunity to actually care for patients and to journey with patients in the end of life.